So, welcome to the ECHO interview series, where we explore how digital communications and new technologies are reshaping health communication. Today, we are joined by Dr. Zexin Marsha, who is an assistant professor at the University of Connecticut. So, Marsha does a lot of work in the area of health misinformation, and in particular looks at how people process risk information. Mm-hmm. And recently, she has focused on issues of alcohol use and cancer risk.
Right?
So, alcohol consumption is normalized and alcohol is enjoyed by many people, but it's also a major risk factor. So what do you do to study this particular topic? And
so I was really drawn to this topic because, well, first of all, for the personal reason, I have 2 alcohol-related deaths in my extended family, and my uncle actually died of liver cancer because of drinking when I was very young. But at the same time, when I first learned that alcohol can cause at least 7 different types of cancer, I was genuinely surprised. I was surprised because I think I studied health communication, but I didn't know about it until several years ago. So, and then the data has shown that public awareness of this knowledge about alcohol cancer was pretty low. Around that time, only less than a third of the U.S. public was aware of the link between alcohol and cancer. I think right now it's a little bit better, around half, 50%. Yeah.
So, what do you think makes this topic particularly challenging to be communicated?
Yeah, I think this topic is challenging to communicate because we're human beings. We do not like any information that is not consistent with our existing beliefs, attitude, and behaviors, right? Like you said that alcohol drinking is widely normal and socially accepted, especially for like moderate drinking. So people don't like it because people still like alcohol drinking. It's part of the culture, but now you tell them that, alcohol can cause some different types of cancer. It's a little bit of threatening.
So you explored alcohol-related information on social media. So what kind of information is circulating on social media about this topic?
Yeah, so in a recent project, we look at TikTok data when the former U.S. Surgeon General first published the report on alcohol cancer advisory last January. So we did topic modeling analysis, try to identify the type of public reactions, and we found, wow, there's so many different types of defensive reactions. I'll give you some examples. So one prominent theme is what we call derogation. Basically, people try to challenge the information by questioning the scientific evidence behind this risk, or trying to cite personal stories like, my grandfather has been drinking his whole life, but he lived a really long life, right? So using anecdotal stories to challenge this population level risk, or they even question the credibility or motives of the government for publishing this report. Another common reaction would be what we call blunting. So people try to divert attention. They would try to talk about processed foods or marijuana so that they don't have to really process the link between alcohol and risk. And honestly, I think people are quite overwhelmed or fatigued about constant warnings about health risks. Right, so everything is danger, but we want to have some fun. That's some like comments that we observed from social media. But with that, I want to say that not all emotion reactions are negative. We did observe some positive or supportive voices, especially from people who are sober or who have been negatively affected by alcohol-related like accidental disease. Yeah.
That's super interesting. And I know that you also look in your work about some strategies that we can use in order to communicate about these topics. And in particular, you look at narratives and pictorial images.
Yes.
So what have you learned from your research?
So I actually found that narrative messages can reduce defensive reactions to information about alcohol and cancer risk. And we also saw that narrative messages are quite effective in attracting attention or establish emotional connection between the audience and the character. And these reactions in turn can promote behavior change. So then later on, I translate this idea of narrative messages into pictorial warning labels. Usually when we talk about the stories, we talk about the text-based stories or video-based stories, right? But how can you tell stories through a single image? Because that's the case for pictorial warning label. So my formative research showed that yes, people can perceive a story through a single image if the image features a discernible and believable character and provides relevant context. So for example, showing them an image of a believable cancer patient receiving medical treatment can be perceived as a narrative. And compared to the traditional type of warning label that feature graphic health effects, my work showed the promise of narrative warning labels, right? So they are more likely to attract attention and engage emotions, which in turn promote greater intentions to reduce or stop drinking alcohol.
That's super interesting. So related to the warning labels,
yes.
So how do you envision that, like on the bottle of the packaging of the alcohol? How does...
That's a great question. For my previous studies, I just tested the warning standalone, but for my upcoming study, I put those warning labels on the front package of the bottle. I don't think people will like it, right?
I mean, there was a lot of discussion also related to other pictorial warning that I think about
cigarettes, right?
Cigarettes, exactly. So I can expect that.
Yeah. But my work actually found that narrative pictorial warning labels gathered greater public support if they were implemented on alcohol packages compared to graphic warning labels. So that's a little bit good news, right? But I still think that it might take a long way for people really to accept that. But this design, this narrow type of design is a little bit better or more acceptable than graphic warning labels.
Okay, I see.
Yeah.
I see. No, that's wonderful. So a key feature of your work is that you also use technology, different types of technology, as a method to carry out health communication research. So can you tell us a little bit more about your approach to research using these technologies?
Oh yeah, of course. I view myself as an experimentalist, and I love exploring new tools and methods. I've done work using virtual reality, and mainly I was interested in comparing stories presented in virtual reality versus stories presented in 2D screen like a computer or tablet, right? Which one is more effective? And my work indeed shows that compared to stories presented on a 2D screen, those presented in the virtual or immersive environments is more persuasive and more transporting. And I think virtual reality can really help me to understand how people would react, right, to health information in a more natural, realistic way, because it allows us to create more realistic, mediated environments. Besides virtual reality, recently I've been exploring using computational methods to analyze large-scale social media data, which is the project that I just talked about. I think with computational tools, it can tell us, what people are talking about health or risk online and how they're talking about it.
So for the friends at home, what do you mean exactly when you talk about computational methods?
First of all, I am still learning about computational methods, and a lot of this work is collaborative. Right now, I'm using what we call topic modeling analysis. Basically, it uses some statistical model to group text to find the similarities on a large group of text, so that the text can be grouped based on themes or topics. So that is the method that we use to identify public reactions toward this, I'll call it cancer risk, the research that I just talked about.
I think that there is so much promise in using these methods to discover health information. Mm-hmm. And related to that, so what have all these methods that you have used, AI or virtual reality, what have they allowed you to discover that more traditional science method would have not? Let us see.
I think, that's a really good question. I think traditionally we rely a lot, for example, on surveys or in-lab experiments, right? Where we ask people to say a message and then report how they feel or what they think. But with the methods like virtual reality or computational methods, we can observe what people actually do or think or feel in a more real-world context. Right? So, for example, with virtual reality, we can create realistic social environments to observe how people would respond to a certain piece of information. With computational methods, we can understand what people are talking about online about health or any topics.
Absolutely. I am not very clear. And what surprised you the most in using these methods? I think not with virtual reality or not with computational methods, but something came up about eye tracking. So in the past year, I've used eye tracking to measure attention. So eye tracking allows us to objectively measure people's visual attention when you're exposed to a certain message, which is not accessible through self-reports. And interestingly, my work found that attention measured through eye tracking is not significantly correlated with attention measured through self-reports. That's so interesting.
I know, and I had a hard time figuring out why, because we are measuring attention through different methods. So my speculation is that maybe they just capture different aspects of attention, right? So eye tracking focuses on or capture the real-time attention during message exposure. But self-reports may reflect or more reflect what people remember or think they paid attention to, right? So it's more like a retrospective recollection in terms of what they remember, but then eye tracking is more about real-time objective measure of attention. I still need to figure out why it's the case, and I want to dig into literature a little bit more to see if similar findings are reported in other work as well.
But isn't that one of the most beautiful parts of doing research? You try to answer a question, and in the process, considering what you discover, more questions emerge. So it's an eternal search.
Exactly. One question leads to another and to another, indeed. Yeah.
So thinking about the research that you're doing and everything that we are discovering related to alcohol communication, for example, where do you see the field moving forwards in the future years?
Well, right now I think everybody's talking about AI. So I'm also thinking about how to integrate AI as a tool to study health communication or as a tool to improve health communication. And I'm really excited about the potential of AI in our field. So, for example, I'm currently using AI, this type of computational methods, to analyze large-scale social media data. I also see the potential of using AI to create health messages more efficiently. And recently, I'm really interested in exploring or developing personalized AI chatbots to, for example, correct misinformation and deliver risk information that is tailored to each message recipient. And I've read some recent studies, and indeed, some studies have already shown that talking with AI can reduce conspiracy beliefs. So, yeah, so that's something I'm really excited about and want to explore.
Well, then I really hope you will come back to our
sure.
series to tell us more about what you will discover, because it sounds really interesting.
Thank you. Yeah, of course.
So I have now a question for our friends at home. So do you think that people don't want to believe alcohol-related information or the fact that alcohol can lead to many risks? Or do you think that they don't want to? So it's not that they don't understand, but they don't want to believe this. And related to social media messaging, can you recall a message that was particularly effective, that stuck with you? Let us know in the comments, because we really would love to hear what you have to say. Thank you so much, Marsha, for sharing your research and bringing us closer to the world that you are exploring.
Thank you, Aurora, for inviting me. Glad to be here and share my work.
Thanks. And thanks also to our friends at home for watching this episode. And please don't forget to follow. We'll see you in the next interview.